Rick Anthony, thank you for sitting down here in the MTV studio, which is at the BioSkills area of Academy, AAOS 2025. This was a vision we had, and I just want to hear more about STI, Surgical Training Institute. First off, thank you for the partnership. It's been wonderful so far.
Yeah, it's been great. We're getting a lot of good exposure, both for our clients and for the surgeons that really make things happen. And, the Surgical Training Institute's all about educating and informing both this surgical community, our medical device partners, and patients for that matter.
So tell me, catch us up to speed. If somebody doesn't know what you all do, just what's going on at STI?
I spent many years in pharmaceutical industry, and then we can talk about that in a minute. But what I learned was that it's much different. A physician in medical devices that handles medical devices is much more of as much an art as it is a science. Where pharmaceutical, a doctor, take a pill and call me in the morning.
Right.
And it's based on kind of known factors, and it's more science-based, and they know what they prescribe. But a surgeon has to look at the patient, all the characteristics of the patient. He has to plan a surgery. He has to use the correct device,
right,
and he has to be able to know how to apply it and perform the surgery properly. And they don't learn that all in medical school, and they're just printed a surgical document and walk out. They have to actually practice it over and over again, hundreds if not thousands of times, and every time they pick up a new device, they have to learn it. And I found that there wasn't really a service that could provide that in a very standardized format, a laboratory which they could use to perform BioSkills in. And BioSkills is using human anatomical specimens.
Right.
Those are people who have donated their bodies to science. And we use not the whole body, but usually parts of it based on what they're operating on. So if they're doing a knee surgery, we will have a leg specimen that they can practice on. And you can't learn about human anatomy from a simulator or a model.
No.
The human body, the gold standard is human anatomical tissue. And that's why even in med school, they have to learn on donated specimens.
That's right.
Specimens.
So it's very complex. There's a lot of logistics and moving parts to this business.
Well, yeah. I mean, logistics is probably most of it. Once we've built the laboratories, which we build from the ground up, and these are 1,000 square foot mobile facilities, or tractor trailers, 53-foot tractor trailers that open up to 20 feet, 4 feet wide, and you get about 1,000 square feet of laboratory space that you could train multiple surgeons in at a time, educate multiple doctors. We sometimes have 60, 70 people in there at a time.
Wow.
At multiple stations, up to 20, anywhere, usually from 8 to even 20 stations, depending on the surgical procedure and the amount of equipment you have. And so we move right into next to a hospital. The doctor doesn't have to leave their home. They can come in and get trained at any time of the day or night, and we're there to provide that for their.
Yeah, I'd like to drill down on that value, because I think some people may ask, well, why does this? What's the need for it to be mobile and on the truck? And you can probably answer that better than anyone, having built this business.
Well, there's multiple benefits from it. The first is travel for a doctor today is just impossible. I mean, a typical surgeon, orthopedic surgeon, sees maybe 60 patients a week. And every time they're a day away from their office, they're not only not treating their patients, they're losing business. The hospital's losing business. They, and to go get a training, across the country, or even, just take a 3-hour flight, be away from the family for a day, do the training. If it's, hopefully it's only a day, maybe 2 days, and then fly back.
Right.
And get so it's just a very disruptive to their overall schedule. And a lot of them just don't have the time. And during COVID, they weren't allowed to travel. So but they still need to do the training,
That's right.
right? And so that's one big element, is that doctors want to have it in their backyard.
Yeah.
But there are not that many fixed facilities. Used to be a lot of this was done at hospitals and medical centers. They don't do that as much anymore because of a number of factors, primarily which is they don't have the space for it. That space in a hospital is a financial element.
Yes.
Meaning they got to charge per square foot.
Yes.
And if they devote it to training space, if they put 20,000 feet of training space in, they don't have 20,000 square feet of operating room or 20,000 square feet of beds. They're losing space. So a lot of the hospitals and medical centers just stopped doing that. And now, so that went to private institutions, and there are not that many of them. And there's kind of located at, most of your convention areas like Las Vegas and maybe Boston and
Sure.
San Diego, a few like where you are now.
Yeah.
But they're not everywhere.
They're not. And so so it's fascinating to me. I've been on the device company side of things, and I understand this is a need, but can you take us back to where you were in the genesis of this, like where this started?
Well, it really started, my uncle had an anterior approach hip replacement. And the doctor had only done it twice. And the third time was not a charm. And my uncle never was able to walk again. And it got me thinking about these surgeries they require a level of skill, and it's as much art as it is science. It's not as simple as people think.
Right.
And in fact, most of your, medical malpractice and surgery revolves around the early stages of the doctor trying a procedure on a live human.
Right.
And I thought, well, here, training is really necessary. Not only training, but education. The body's anatomy. Everybody thinks we're just like Grey's Anatomy. We all have the same bones and the same nerves and the same muscles.
Yeah.
But there's about a 15% difference between everybody. You've got a nerve that you might have that runs down a different way than
Sure.
it does in another patient. And until the doctor gets a lot of exposures to those variations, they don't even understand the anatomy very deeply. And they may only, in fact, if they operate in a particular procedure, you might do it an anterior approach, or they might want to switch to a posterior approach. But if they've not worked on that area, they work in an area about the size, of a 6x6 square. And until they've relearned that anatomy, there's a lot of opportunity to make mistakes.
So your uncle had an anterior approach.
Yep.
You saw that maybe there was an opportunity to help that. Like,
where did it to reduce that? The more education and skill training they have,
Yep.
the lower the potential for injury to the patient.
Agreed.
The better the outcome of the patient. Not just injuries aside, just the outcome. Improving the outcome, shortening the stay in the hospital for recovery, shortening the rehab. The more practice they have with the better technologies, then the better the outcome of the patient. Mm-hmm. And I thought, well, okay, we'll bring this to the doctor. Instead of moving, the Muhammad to the mountain, we'll bring the mountain to Muhammad, so to speak. And we just said, well, let's make it mobile. I was thinking of building just more laboratories in fixed locations, but there's doctors all over the country. They're scattered. So what is better to bring the whole laboratory to them, to let them get their training on site. And so I started with one truck at a AAOS meeting.
Really?
Yeah, 15 years ago. We were at the AAOS meeting in New Orleans. We parked a truck. I built a lab up, put my wife in a STI t-shirt.
Nice.
Yeah, she was a booth babe, you might.
The original.
Yeah, the original
booth
babe for STI.
Amazing.
And we had mannequins out on the surgical tables.
Yeah.
And we had about 2,000 people go through that lab, and didn't know customers until we left that week. We had customers. First big customer was actually DePuy.
Wow.
Orthopedics.
And it's so cool to hear that story around. You saw this. You went for it. It was new. It was disruptive. It was a new category.
Yeah, new. That was the hardest part. It took about 3 years for companies to accept that you could do things mobilely, things that they used to go to a hospital for, they used to go to these fixed giant facilities for, that it was all under control, that we could control it. We can control the biohazard waste. We could control we could clean the instruments. We had all the equipment. We had the electricity, the water. Everything was self-contained. And it took about 3 years for them to understand that we could pull it off, because anybody can build one. Anybody can build a truck, make a lab out of it. And a lot of people tried. But it's not that. It's the people and it's the logistics of moving all those moving parts around. You're not only moving the lab, you're moving specimens, you're moving equipment for the client's equipment, their client's people, and they're going to a place and then you're moving to the next one. And that takes a lot of logistics. We had to build all kinds of systems that we could meet everything when we arrive within a 2-hour window, and everything goes away within our 2-hour window of leaving.
Wow.
And we have to be able to do that and move on to the next location. And one of our trucks can hit 120, 140 events a year. And, we had up to 17 trucks, and you're moving all around the country. That's a lot of moving parts, a lot of moving people, and it takes a lot of logistics.
It's amazing. And I've seen, working together on a few projects here, some of the behind the scenes, like it's a lot of work, it's a lot of setup, it's a lot of just know-how that you and the team have. And I would agree.
Well, I've been fortunate. My team, the average length of my employment is 12 years. Yeah, so a lot of my guys have been here, since almost the beginning. And that longevity, they've learned, they know some of these devices better than the people that sell them. And their skill at setting up, at helping everybody is really the key. The staff is the key.
I would agree. That's so cool. And it's been great meeting a lot of them here at Academy. Let's talk about future. Like, where's STI going? I know we've spoken a lot about what we could collectively do with MedTech Voice, but where's your company going? Where's the future?
Well, I think education is undervalued in the whole, you call it the marketing and sales approach to medical devices. They look at education, as a gimme, like as something that it's nice if we can do it, but we can do it with a simulator or a picture or a video, or art, or an AV kind of thing.
Sure,
and,
VR.
Yeah. And it just, VR. It can't replace a surgeon. Is an active being. They like to get their hands into the body. They like to feel the instrument. It's very tactile. It's very skill-based. One surgeon might be good with one particular device. They might not be good with the other device that's doing the same procedure. But they learn it. They become skilled with it because it's comfortable with them. And you can't get that from VR or from a simulator, because tissue, rubber tissue or a model, a simulation, does not feel like tissue. There's no color differential to speak of within, when you get into the tissue. You got to be able to recognize structure and texture and tactile feels. And that's only achieved through, working in the BioSkills environment.
And so what are your customers are largely medical device
companies, hospitals, Department of Defense, first responders. Yep. We train a lot. We do CME courses. The organizations like the AAOS, NAS, AUA, AAOS, these are all medical organizations who have a focus on a particular specialty and want to provide that educational experience to their attendees. Right. And we can bring it right onto the exhibit floor, and they can get both practice in the sponsors' products, as well as provide CME courses. We do a lot. Yep. We do quite a bit of CME, and the CME is very important because in order to stay credentialed, the surgeons have to have so many credits a year. Varies between specialty, of course, but if they don't get it, they don't stay credentialed. Right. And it's something that I don't think most of CME, continuing medical education, is something that most people don't realize. Doctors are basically going to school their whole lives. Yeah. When they pick up a scalpel to the last day they do a surgery, they're always trying to learn and improve on their skill set. And we give them that opportunity.
That's amazing.
Yeah. And let me just continue to answer your question, in that where are we going from here, I see ourselves integrating more into that process in responding to the surgeons. In the past, it's always been the sponsors, the companies who've approached them and say, hey, you want to do a lab? And the doctors, maybe they would be interested, maybe they'd be more interested in something else. Our objective now is we're going to have the doctors give us the feedback on their practice and what do they want. We want them to request labs from us, request events, specific training that they want to see for themselves, for their fellows, for their surgical teams. Because a surgery is not one guy with a scalpel; it's a whole team. And it's a team effort to learn the procedure. And I think we want to be part of that whole process, where from the education to the adopting the product to its use in its continuing use for continuing changes,
Sure.
and be all part of that process for our sponsors as well.
No, it's exciting. And, when I think about it, like you're at an inflection point too, as you lean into more media, the ability to stream, the ability to, pipe and share live what's happening on the mobile trucks.
Well, that is that the technology has advanced quite a bit. I mean, we tried to do this earlier on, especially at more of the fixed conferences, where we tried to videotape and present the surgeries as they were occurring in our laboratories. The technology just wasn't there. Now, recently, literally in this last year, we've worked with a company called Rods and Cones, which provides a very compact kit. And I always say that, video capturing a surgical event is not the same as videotaping a wedding.
Right.
It has all this noise going around. There's multiple people involved. There's a lot of people interacting with the patient, and their equipment is now allowing us to capture it very seamlessly. And the technology now allows us to caption it, bookmark it in stages, translate it into other languages. And where in the past, a surgeon have come in, they trained on something, a month later, did they remember it very much? Maybe not. Now they'll be able to go back after they've done our course, do a QR code, they can come back in and review what they've done in the past in one of our labs. And they can have a whole library of procedures that they can review.
And that's valuable, because once you have a library, then you can start to take advantage of the data, the last mile data. What are the doctors and attendees interested in learning, right? Where are some gaps?
Well, not only we can query them and ask them what they want to know, but we can also look at their viewing of the video, right? So if you have an hour-long surgical procedure and you find 80% of your surgeons are focusing on 5-10 minutes of it, where it's most difficult, or the device has some, is more tricky, then you want to be able to, go back and understand that. Ask them, why is that an issue? You can do analytics on that video.
Sure. Yeah. And that's the future. I mean, there's analytics, there's the data, there's just the ability to maybe predict where the market's going.
And where the next innovation is going to come from.
That's right.
If this is where they're having trouble, maybe we need some innovation that will speed up the surgery, shave
exactly right.
5-10 minutes off.
And I see this clearly as education being a leading indicator into where the innovation, what markets, where people should be placing their bets and investing. And I agree completely that innovation, or that education, is a critical component to innovation.
Well, it is marketing in a sense. You can't help it for surgery, because, a surgeon is not going to make a decision on the best steak he ate from the particular company, which restaurant he went to was the best. Oh, I'll use that tool. Right. But he's going to do it after practicing with that instrument and learning from it. And when he is educated about it, he'll make the right decision on what to use in his practice. And it won't be based on, getting a nice pen or,
no,
or a flyer, or some flyer in the back of a surgical journal.
Not at all. I mean, we're the industry side is a valuable component to, innovation and patient care, because doctors, when they're holding instruments for the first time, that's not something they want to necessarily experiment on, right? And so when these companies are coming in, they have to understand it's a workflow. There's learning curves, all those things.
Oh.
But also to your point about where is this market headed? Let's take orthopedics, right? Anterior hip, right? Right now, I believe it's about split down the middle of posterior approach and anterior approach. But, what are the reasons why one would do one versus the other? Or what are ways that they could take information, right, and make decisions and
That's
strategize?
right. And do they have the right tools and procedures to offer the patient?
Yeah.
Because every patient is different, and you talk about anterior or posterior or there's lateral approach. Which one's best for a patient? It has a lot to do with their anatomy, their health, other health characteristics,
Right.
and their injuries or their what is causing their problems. You have to assess that, and that judges which procedure they have to do. Everybody thinks it's the same procedure. You get a hip replacement, you get a knee replacement. It's the same product. It's the same. No, it isn't. It's not a hinge. We're not machines.
Yeah.
We're very complex biological organisms, and there's a lot more to the decision process that the surgeon has to make than simply is his knee going to go up and down.
Yeah.
Right.
100%. Well, Rick, I cannot thank you enough for the opportunity to be here in partnership with Surgical Training Institute, Academy, AAOS. It's just been great. Day one, a lot of energy in this room to be able to sit down and have a conversation. It's been an honor. Is there anything else you'd like to share? Anything at all while we're sitting here?
No, I think you're going to see, we're going to be at many more conferences this year. In fact, you'll be joining us, I think, at a few of them. Mm-hmm. And you'll see this evolve. And I think it's hard to verbalize to our customers, which are the sponsored companies, where we're going to be taking this until they see it grow, until they see what we can do with it, until we build it up. Then they'll see and what value it can provide them, and in subsequent conferences, you're going to learn more about how STI, MTV Studios, and Rods and Tones all together can provide a real value add to their efforts.
Well, we can't wait. We're super excited. Thanks for sharing more of a story of STI, Surgical Training Institute. Rick Anthony, legend of the game, and excited to see where this goes.
Good. Thank you.
Great to see you.
Yep.
All right, brother.
Take care.